What's going on, y'all? Welcome back to another episode of the Struggle to Strength podcast, your source for real-life application on how to turn your struggles into strengths in all things mind, muscle, and money. I am your host, Josh Levine, and I am joined here by my longtime friend and my co-host, Travis Hatch. And today, we can get real with y'all. We have a mental health crisis in this country. There are a lot of treatments, and some of them are slowly growing in popularity and potential efficacy, including the use of psychedelic-assisted therapy. This should be of no news to you. You might not like it, you might not love it, but either way, it's showing promise. So today we have Dr. Sandeep Nayak, postdoctorate research fellow at Johns Hopkins Center for Psychedelic and Consciousness Research, who's here to speak with us about the benefits of psychedelic-assisted therapy and provide some insight into the three-step process that they use to create lasting change. This was an absolutely phenomenal conversation on a topic that you know we are already passionate about, and we are coming at you to just deliver some good information so that we can all learn and we can all grow together. Now, before we get into it, as always, if you love this episode, please give us 5 stars on Apple or a follow on Spotify. Share us on your socials. You can find me at Josh Levine Fitness, Travis at Travis Hawks Media. That's it. Buckle up to chat one of our favorite topics with the expert himself, Dr. Sandeep Nayak. Kind of dove into to start a little bit about like how you learned about psychedelics, how you became so passionate about them, and the things that you went into that kind of got you to where you are now studying them, which is super cool at Johns Hopkins.
Yeah. So I guess I'll start with where I am now, then I'll kind of back up to how I got there. But I'm a psychiatrist at Hopkins, and I'm also a postdoctoral researcher, meaning most of my time is, I do see patients, but most of my time is kind of spent doing clinical studies with psychedelics, and mainly psilocybin, which is the active ingredient in mushrooms. So using that for various psychiatric disorders. And so it's basically clinical research with psychedelics. How did I get here? I had sort of 3 or 4 different sort of random separate interests that over time became increasingly intertwined and found this union in this topic. And what were those? So, I mean, basically, I ran across this book when I was in middle school, like a Barnes & Noble, called Doors of Perception, which is this really beautiful, arresting book in which a journalist, Aldous Huxley, takes mescaline, which is a psychedelic, and sort of just make sense of it, this mystical experience he has in light of, the history of literature, religion, all this incredible stuff. Highly recommend this book. And it made such a huge impression on me, mainly for like the mystical aspects of it. But this is just sort of this isolated thing that I didn't really do anything with. I went to college. I studied sort of Buddhist mysticism. I was like a religious studies major. I did meditation research. I went to med school. I did psychiatry, interested in like clinical treatment of addiction patients. Again, these just all felt like kind of totally separate, unrelated things. But then, the convergence was sort of in psychedelic research, where you're treating people with various psychiatric conditions, some of whom have not been helped by traditional treatments, with this drug that produces experiences that themselves are therapeutic, and often those experiences have this mystical quality. And I just have found that it's kind of the perfect mixture for me. And I'm here because I think it can help people, though, apart from the fact that I find it very interesting. Mm-hmm. Maybe that's at least an overview.
And it is fascinating. I mean, I think you and I, we probably both became aware and probably slightly interested, maybe even fascinated by psychedelics and by non-traditional forms of treatment from a relatively young age. Why is it so important? I mean, we've got other forms of treatment, and obviously we're aware of this, but I think for listeners or for people who aren't aware or aren't sold or aren't even don't even understand that this is a possibility. Like, why is this even being studied when we have things like Xanax and Wellbutrin and, SSRIs and all of these other things and whatever else we can use to get to the same end result as we can with psilocybin and other psychedelics?
It's a great question. Well, I think it matters because, one, these don't actually work for everyone. Mm-hmm. They do actually work for a lot of people. I will say that, conventional treatments, but they simply don't work for everyone. The other thing, though, is that even for people that they do work for, I mean, sometimes you have these side effects or otherwise, unpleasant aspects of taking the medication every day. And again, I'm actually a big proponent of conventional treatments, be it medications or psychotherapy, but there are distinct advantages to just having more treatments, particularly ones that are not kind of every single day you're having to dose. Mm-hmm. So it just adds to the toolbox. And I don't really have any pretensions that psychedelic treatment is going to totally replace all existing psychiatric treatment. Mm-hmm. That's a viewpoint that you hear a lot out there. I think that's unrealistic and probably not true. And I think that, the other thing is that even psychedelic therapy is not going to work for everyone. And so maybe that a mixture of these two is going to be just having more options, basically.
I agree. I think there's also kind of like a learning curve to being able to properly and effectively utilize psychedelics in this regard. So in the studies that you're doing, I'm curious to know, like, what kind of dosages are we seeing? Is it used in conjunction with traditional therapy? How exactly, what are tell us more about the studies that you're doing specifically.
Yeah, let me just add one more thing to the last point, actually, which is that something new is also being delivered here, I think. There is something that other treatments are simply not doing that psychedelic treatment, I believe, probably is doing. And we can get into that, but I guess your question now, like, what kind of doses are we talking about? What are we actually doing? Are we pairing this with more typical therapy? Is that right? Yeah. So just, I guess for psilocybin, I mean, typical study dose would be like 20 to 30 milligrams of psilocybin, pure psilocybin. And so if you convert that to like dried mushrooms, that's 3 to 5 grams of dried mushrooms.
Yeah, I was going to say that's a good dose.
So that's not at all a small dose. I mean, like moderate to large. What is going on when the dose is being given? That's just as important. So like early on, I'm talking in the 50s, 60s, 70s. In the beginning, Albert Hoffman accidentally, the guy invented LSD, accidentally took it, began tripping. This was in the 40s. And this kind of ushered in a period of research. Obviously, psychedelics existed in nature, but this ushered in a period of research where people are trying to figure out, what can we do with this? And the very first things that people did was not therapeutic. They were like, oh, this is a way that we can understand psychosis. This is a way we can understand creativity. But they sort of drunkenly stumbled into the therapeutic use of it. So I'll just give you an example. For alcoholism, they initially began using LSD, which actually did have some good efficacy with alcoholism, almost to try to like scare people into hitting rock bottom, if that makes sense. And they found that it was actually producing these highly meaningful, transcendent experiences that were useful. And so I'm rambling a bit, but basically they just kind of messed around, tried different things, and eventually sort of arrived at a pattern, a way of giving, in this case, LSD, that seemed to be useful. And that's kind of the model that we have now. So what is that model? The model is that, and it's quite different from conventional therapy. So basically, there's like 3 stages. You get the preparation stage, which is where you really get to know the person. You develop this kind of sense of trust and rapport, and you help them kind of frame the narrative of what is their problem, what's been going on, how do they understand it. And then you also kind of train them into like the kinds of things that might happen under a large dose of a psychedelic. They might think that they're going crazy. They might lose their sense of self. They might experience eternity. And all this stuff can happen, some of which can be very frightening. And the attitude that you kind of try to inculcate is like, just roll with it, accept whatever's happening in the moment. You can figure it out later. And yeah, so then you give one to many doses and they have these experiences, but just as important is how you help them make sense of it after the fact. And so that's pretty much the model that we use. And surprisingly, it ends up looking fairly similar if somebody is getting treated for depression or smoking cessation or, all these other different conditions that psychedelics are maybe helpful for. The actual model is fairly similar in that respect. It's not, there is in these different studies some targeted treatment towards like smoking cessation or alcohol, but by and large, the bulk of the model is pretty similar. And it's not necessarily all focused directly at this one problem. It's much broader than that, if that makes sense.
That does make sense. I think it makes sense to people who have experienced it. And those who haven't, it's almost, you come to your own answers in a way. And so you're utilizing psychedelics and traditional therapy in order to help guide people to those answers. Is that about right?
Yeah. I think that's right. It's paradoxical because like you're guiding them towards it, but you're also just letting them figure it out on their own in a sense.
Which is psychedelics have an incredible way of allowing you to do that, allowing you to see things from a different perspective, allowing you to be more third person. And sometimes you can't always get there by yourself. And so having the added benefit of traditional therapy or a guide or a shaman in some instances, as they might call it down in South Central America, it's massively helpful. And so this process that these people are going through, does it work with smaller doses? Is it more impactful at higher doses? And how long do these results last, especially as opposed to like a traditional medication that you would take daily?
Medication.
Yeah.
So I guess, does it work with smaller doses? How long do the results last? Again, when they were sort of in the early stage, sort of stumbling around, trying different things, a logical thing that people tried was, psychoanalysis was big back then, 70s, whatever, 60s. And so they thought, why don't we use LSD to facilitate traditional psychoanalytic therapy? Mm-hmm. And you can't really do that when people are tripping on huge doses. It doesn't work.
They're not cooperative.
Yeah, it just totally breaks the whole thing. And so they actually would use lower doses. They weren't like tiny necessarily, but they were low enough that people could sort of open up more. They could still talk. They could still participate in traditional talk psychoanalytic therapy, if that makes sense.
Yeah.
And I think that, nobody really does this nowadays. And I'm actually not too familiar with what the results were. But my sense was that it was useful. It didn't quite take advantage of what psychedelic therapy had to offer. And it also kind of all these elements that I actually do think that a lot of the kinds of things, I think psychedelic therapy is useful in many ways. It's not just one single thing. Mm-hmm. And part of the way in which can be useful is the sort of stuff that comes up in traditional psychotherapy, like revisiting elements of your past that you've not resolved, etc. But I think the way that they initially used it in psycholytic therapy, which is what they called using lower doses with traditional therapy, was limited. And when people would have these like kind of mystical type things, they would sort of write it off and be like, you're getting distracted. This isn't really the point of this. You're avoiding. I think the larger dose, overwhelming experience, that kind of thing, I think tends to lead to greater change.
I agree.
I think we should take maybe a half a step back and kind of define what is actually going on. What is going on in your brain that causes it to be so effective? Cause like, you know, it seems pretty self-explanatory to me, like something like Xanax. You have anxiety, you take Xanax, it makes you stop feeling anxiety. What's going on in your brain when you're experiencing, you know, psilocybin, and why does that have an effect on you?
Yeah. And even if we brought it back a step further, like to start with, like, how does psilocybin work?
Yeah.
Okay.
What effect does that have on your brain, and why does it have an effect?
So these are kind of like the $1 billion questions here. First off, all psychedelics, not just psilocybin, work by stimulating a receptor in your brain. And so they basically, you know, there's serotonin, which is a molecule neurotransmitter in your brain. It's normally doing stuff, and it binds to receptors. And when it binds to a receptor, that's like a signal to do something. And so all drugs basically act by mimicking chemicals or molecules that are naturally in your body. And psychedelics are no exception. So they mimic serotonin, but they mimic serotonin by acting on one single receptor, the 2A receptor. So if you block the 2A receptor, you give somebody a psychedelic, nothing really happens. Now, that's not really an answer though, right? So, okay, well, why does the 2A receptor, you know, cause all these psychedelic effects? And I mean, I guess let's just review what are the psychedelic effects. People talk about the visual stuff, right? The visual stuff is almost entirely irrelevant for the therapeutic effects, though, right? It's totally. I'm not going to say it's meaningless, but it's just a sideshow. I would say one of the hallmarks is that people feel there's an enhanced sense of meaning. Can be an enhanced sense of connectedness. There can be a whole huge broadening of emotional range. I'm talking on both sides. There could be ecstasy to despair. All kinds of like mystical type experiences can happen. People can lose their sense of self, so-called ego death. They can experience eternity. They can experience spiritual rapture. They can also just kind of be more connected to previous memories or previous times, and I think the big picture is that they sort of see things differently. And in seeing things differently, they realize that things can be seen differently, whether that's their own thoughts or their emotions or the narratives they have about themselves. And that's kind of what's going on acutely, like in the moment. But you have to wonder, like, why should taking a drug, whatever experience you might have in the moment, why should that make any difference a month later, right? Doesn't matter how crazy or cool or useful the experience seems to be in the moment. Why in the world would that matter a month later, right? I have dreams every night in which the wildest stuff is happening. It doesn't seem to make any difference on me even the next day, right? And so I'll get to the brain stuff now in a bit, I think, but basically it may be that not only is there something going on acutely, but there's also something going on afterwards. Mm-hmm. And so I guess in terms of what's going on in the brain, I mean, the short answer is like, we don't really know. So I'll give you the longer answer now.
Okay.
There's like two, and to some extent, you know, obviously the mind is the brain is the mind, but it's still useful to talk about these as if they are separate things because they are getting a different side to this. But the brain, there's brain imaging, and then there's kind of more molecular stuff that we can talk about. The basic gist of the brain imaging findings, and I honestly don't think that there's a whole lot we can make of this. The basic gist of it is that while you're on a psychedelic, parts of your brain that, like the way in which parts of your brain talk to each other kind of is broken down. So parts of your brain that normally talk together to each other aren't talking to each other as much. Parts of your brain that normally don't talk to each other are talking to each other more. Just the usual, you know, brain network pattern is altered. And so what does that mean? I mean, I don't know that actually tells us all that much in terms of explaining in a very specific way what's going on. You kind of can get there by analogy, like, oh, people are hearing colors or they're seeing sound. Mm-hmm. In that sense, maybe you can, but I actually don't think we get all that far from the brain imaging in terms of really understanding in a plain English way why these should be helpful. Like, why should it be that if you break down your normal brain rhythms that should explain something useful. I don't know. However, also I have a tendency to just going on and on, so just stop.
No,
this
this
is perfect.
This is fascinating. I love it.
So,
Keep going.
all right. The other thing though, and this I actually do think is quite possibly explanatory of some real benefit, right? The mystery is like, why does this experience on a Tuesday lead to benefits a month from now, 6 months from now? And I think there's something about learning that happens. And so we have animal data where like, oh, the study's so cool. So like they took mice and they gave them psilocybin. This is like a study out of Yale. They gave them psilocybin or placebo, and they could see that like their dendritic spine. So these are parts of your neurons that touch other neurons, basically communicate. And so basically, anytime your brain is doing something, it's got to change in some way. And that's kind of the point of doing psychedelics therapeutically, is to induce some kind of change, hopefully, right? But basically, the gist is that psychedelics lead to, again, this is in mice, sort of in rapid and enduring changes in the way in the structure of your brain's dendrites, which is a sign of neuroplasticity, basically. And I think there's more work that needs to be done on that in terms of pinning down the exact relationship with its therapeutic effects. But for me, I mean, maybe it's a sign that like, maybe this is kind of a way of understanding why there should be an enduring effect. It's not just that you have these very meaningful experiences in which you're able to make sense of a lot of things, feel differently, and realize all this stuff, but the message also sticks more.
Mm-hmm.
And so I think it also really matters what you do afterwards. It's not just that you've had this experience. It's also like, okay, now go forth and fix your life.
Mm-hmm.
And keep it going, right?
Does that in any way kind of touch on the notion that psilocybin can help develop new neural pathways in your brain? Because I've always felt as though the learning curve of certain things, especially about myself, is expedited with the use of psilocybin. And that could be either things about my mental health that I'm trying to overcome, that parts of my life or my being that I'm trying to improve upon or change in some way, or even I've, for a long time now, felt as though things like movement patterns, exercises, could be better learned under small doses of psilocybin. And it sounds like this is kind of what they were doing with these mice.
Yeah, kind of. I mean, so let's back up actually, because like the short answer is I don't actually know the answer to your question. But we talk about neuroplasticity, right? Enhancing the brain's ability to change. Mm-hmm. And so if you're stuck in depression, perhaps that's a good thing, right? But your brain is constantly changing, and neuroplasticity is not always good. So like if you're in the process of getting addicted to cocaine, guess what? Your brain is changing. Mm-hmm. That's inducing some kind of neuroplasticity. And so it quickly becomes a question of like, well, where and what, right? It's not necessarily good to just generally induce global enhancement of, your brain's ability to change. Bad things could presumably happen too. Mm-hmm. And so that's probably not the case that's happening. It probably is more specific and localized to like certain areas, certain regions. But it's unclear. I mean, if somebody has a stroke, they're paralyzed in their arm, now they're in rehab, would psychedelics help them, develop new neural connections that could help them? Because when you have a stroke, I mean, that brain is dead, right? Mm-hmm. You don't recover by regrowing parts of brain. You recover by like having old parts of brain getting repurposed for new things. So sure, we just kind of don't know. I mean, people are going to start looking at that in the near future.
That's really cool.
Strokes, but it's a little unclear right now, I think.
It's
really cool.
I heard an analogy like I don't know if you've heard this one, it's the snow globe or like ski mountain analogy, which is like, your brain's always learning, and you kind of get stuck in certain kind of like certain pathways, certain neural pathways, and then doing like taking like a strong dose of psilocybin is like shaking the snow globe, or like fresh snow falling on the mountain. Like you're able to form new tracks, new pathways. Do you think that that's a good analogy?
I think it's a great analogy to explain and describe what people are experiencing. I'm a little less clear on how good of an analogy it is to actually describe what's going on in the brain. It seems plausible, but I'm a little reluctant to extend it there too far, if that makes sense.
Totally. Yeah. Yeah. It's like one thing doesn't necessarily equal another. And that makes sense, especially with how complicated something like the brain is. Like, we're asking you these questions and you're like, bro, I'm trying to figure these out, like this shit is complicated. Give me some time.
I'll also just kind of share some of my perspective on this, right? Like I was in med school and I was deciding between neurology and psychiatry. These are both fields of medicine that deal with, in some sense, the brain, right? And in neurology, I found that, wow, we know how all of these diseases work, right? We know exactly the pathology that's going on when somebody's got like this stroke in this region, or know exactly the gene that's going on with Huntington's disease, but that knowledge didn't translate to helping people, right? It's like we know exactly what the mechanism is. It doesn't really translate. Maybe someday down the road it will. And in psychiatry, it's like we know nothing about what's going on. We have no idea how these drugs work. We have no idea how even the pathologies works. And yet I was shocked to find that like actually most people were able to be helped by these treatments. And so it kind of impressed upon me, like knowing how something works is very useful, but it can sometimes be totally independent from learning about how it, like whether it works and how to use it effectively.
Mm-hmm.
And so I found for myself that those questions of, well, why does it work and what's the exact mechanism would sometimes drag me into like rabbit holes where, and I was able to kind of ground myself more by like, all right, let's focus on like, does it work? Yeah. And if so, what's the best way to use it? I don't want to be too, obviously it's useful to know both, but that kind of was impressed upon me in a big way. And I think,
Yeah, that makes sense. I mean, like at the end of the day, we're just looking for something that works and works well and is sustainable and healthy, and that it's not going to ruin people's lives. So what are the best practices? And I think that for a long time we've kind of overlooked the stuff that's in our backyard with marijuana, psilocybin, things that have been around. Do you have any insight or any feelings, I guess, on why that is and what the future looks like for these things? Because in Colorado, we're starting to see that things like ketamine therapy, psilocybin therapy are popping up a couple places throughout the country. So what do you think was the catalyst for like actually doing this research? And what do you think, what direction are we headed in terms of its effective use?
I mean, it's weird. It's so different drug to drug. So like cannabis versus ketamine versus MDMA versus psilocybin, like, I think I would say that psilocybin and MDMA are kind of in a similar boat, but ketamine and cannabis are on totally different tracks.
Yeah.
And it's almost hard to compare them. I mean, ketamine is legal, right? Like FDA approved already. Anyone can, with a medical license, can.
Ketamine-assisted therapy.
Yeah.
Yeah.
Cannabis, it's unfortunate in America. Like a lot of things that, like, so I believe that no drug should be criminalized.
Agreed.
Agree.
That's totally separate from considerations about, are they good? Are they bad? Right. And
they're all just tools.
Yeah. I mean, you can kill yourself with a hammer, right?
Yeah.
Or you can nail you do whatever you do with the hammer, right? But if you're sending people to jail for, I think you get what I'm saying.
Yeah.
That's totally separate from. So I think what you often see is that things get legitimized through the medical system in the US in particular. And with recreational cannabis, I think that like medicalization of cannabis was often a way for like a doorway for cannabis to be recreationally legalized, which I really wish that happened on its own terms. Yeah. I wish it could have just been recreationally legalized, but of course it was actually useful, right? That was actually a way for it to happen. And it has actually kind of muddied the waters to some extent in terms of like nobody's really doing research on medical uses of cannabis anymore. I mean, it's actually a lot harder to do that now because, So I in many ways, I think that there should be separate tracks, right? Of like legal process for just non-medical use. I mean, if people want to use something spiritually, ceremonially, just for their curiosity, and it's not all that risky to them, I think that should be, legally available. I don't think that should be roped into the larger considerations of like this one thing, which is like medical research into a drug. That makes sense. Where are things going? I mean, I think that it is likely that we are going to see psilocybin approved for given FDA approval. And I think that's useful. I mean, again, I want to be clear. I don't think that like this should be the only way that people should have access to psilocybin necessarily, right? But I think that for the purpose of treating a psychiatric disorder, it's very, very useful to have research on people in that population. Because I think there's a tendency for people to think that like, I don't know, I guess I can just sum this up by saying like I think the research is actually useful and sheds light on like how to use these in ways that are not necessarily going to happen if we just completely legislatively.
I agree.
Medical use.
I agree because like we said earlier on in the call, I think that there's almost like a learning curve to utilizing psychedelics effectively and utilizing any drug effectively, utilizing any drug as a tool and not like a party favor, right? Because I think that's kind of the vision that a lot of people get when they think of drugs, that like the drugs that we're talking about, they think of them as like party favors, or ways that they can party and kind of just get fucked up. And we're like, no, these are tools. They're powerful tools, and used properly, they can deliver really positive results, especially when we have research that we're conducting to show what kind of results they can achieve and how we can achieve them. They might not work for everybody, but if it works, we shouldn't keep it from people. Yeah,
I agree. And I'll also say that I've had the privilege of being able to now participate in 3 different trials with patients with depression, patients with anorexia, and then patients with kind of combination of depression and alcohol use disorder. And these are different groups of people with different problems. And it's not just that, like, how should psychedelics be used therapeutically? It's like people with anorexia have unique problems that people without anorexia have other, there are unique struggles that are, it's important for somebody trying to help them to understand the kinds of struggles that they have, just as a starting point, even much less like how does one actually overcome those? I mean, in general, my perspective is that if you are trying to treat somebody with psychedelic therapy, you should probably know how to treat them without psychedelic therapy, because those skills are going to be, not only those skills, but that understanding of what their problems actually are is going to be very useful and in fact essential for them. And again, that's separate from the fact that like people can get great benefit by exploring things on their own. And again, I don't necessarily think that, I don't necessarily yeah, I just don't want all possible future uses of psychedelics to get crammed through the medical door. But I also don't think we should lose the fact that like the medical, there's actually a use to medicalization as well.
Mm-hmm. Yep, I agree. And I also will say that, you know, having used psilocybin before and during therapy, you know, I don't know if you guys have any research on this, but I would be very interested to learn if there are numbers that can correlate almost like what we would call progress in therapy versus the same length of time and the amount of progress that you can make with ketamine-assisted therapy. And yes, granted, like we don't always have to use things medicinally. We don't always have to use this as a therapeutic tool. But do we have any research that shows how much faster people can progress and how much more effective it can be in a certain amount of time?
I mean, not directly in the sense that we haven't directly compared conventional therapy with psilocybin assisted therapy, but indirectly, yes, in the sense that like, I mean, some of these studies, it's like single doses, benefits that are still there. Like
breakthrough.
Yeah. And so I have very little doubt that this can kind of make things happen more quickly than in conventional therapy, while still in many cases, not only achieving results, but actually some processes that I think that will happen in conventional therapy. And again, I think people kind of want to fixate on like, what's the thing that explains why this is useful? Is it the mystical experience? Is it the reliving of childhood, whatever? Is it this? Is it that? And I think it's actually sometimes different for different people. People that have a lot of experience with therapy, it seems to be that some of them will bring in their, like, sometimes what'll happen during psilocybin therapy is it'll be a continuation of that. So yeah, I don't have a good answer to your question other than I think it's quite probable.
Yeah, I agree. I'm excited for what it holds. Now, while you were talking, I was thinking about, you know, you were talking about what the thing is that makes it so powerful. And what I'm curious is to know is what strain of psilocybin or strains of psilocybin are you guys using? Because there are a number of different types of mushrooms, right?
There are hundreds.
Or maybe it's all the same psilocybin and it's different types of mushrooms.
Yeah, there's hundreds of psilocybin mushrooms, but what we use in almost all of the trials around the world, it's not just we, but in general, with some exceptions, is synthetic psilocybin.
Okay.
It didn't touch any mushroom. And that's going to be the same kind of pretty much no matter what.
Okay. Interesting. Now, do you have any insight as to whether or not the type of mushroom may impact the result? Because what I'm imagining is, you know, there are people out there, there are people that are listening to this podcast, and even myself, for example, that may have preferences or may have different experiences based on whether or not, you know, they're using one type of mushroom versus another type of mushroom. Yeah,
I do have thoughts on this actually. And so, I mean, obviously some mushrooms are just stronger than the others. That's probably not what we're talking about. But are some of them actually genuinely different? And the way in which they would be different would be that there's actually other compounds in the mushroom other than psilocybin or psilocin that are contributing something. And so this actually does seem to be the case, for example, cannabis, where it's not just THC, it's not just CBD. There's actually other things in different strains of cannabis that might not line up perfectly with indica, sativa, or all these different things, but there are genuine differences that can be explained if you drill down. With psilocybin mushrooms, so I think not only is that true, people kind of like that.
Yeah, I know. Well, because you can have a different experience.
Right. And so with psilocybin mushrooms, I am willing to bet that it's not true. And yet people still kind of like the idea, the entourage effect. Why do people like the idea? It's because it makes nature better than man-made synthetic psilocybin. And we don't fully know, right? But my guess is that it's not. Maria Sabina, this is the Mexican shaman who sort of introduced Gordon Wasson. This is like the guy who, subsequently introduced psilocybin to the Western world. So she was the Mexican shaman who introduced psilocybin mushrooms to Gordon Wasson. Forget exactly who it was, but at some point they synthesized psilocybin. I think it was Albert Hoffman, the guy who invented LSD. He synthesized psilocybin, and somebody brought Maria Sabina synthesized psilocybin, gave it to her. This woman who, does all these mushroom ceremonies. And I kind of asked her, like, what do you think? And she's like, this is great. Now I can do this when it's not in the rainy season or whatever. It's the same thing, basically. If there are differences, they're going to be pretty subtle. And you're going to see studies where people directly compare mushrooms or mushroom-derived stuff and synthetic. And so far, there's not really any other compounds in mushrooms that we know of are having very significant psychoactive effects.
Mm-hmm. It's interesting because, full transparency, I'm, the microdoses that I get from time to time, every now and then, the girl that I get some microdoses from, they'll have, some are the pink buffalo, some are the albino, some are the penis envy, the golden teachers, the peaked creepers. They got all these different, there's so many different types of mushrooms. And I think you're right. I think people, whether or not there is a difference, people want there to be a difference. But you're saying that it's much more noticeable and it's much more likely that there are differences from strains of cannabis, for example, than there are strains of mushrooms. So if people are getting mushrooms, they're pretty much just mushrooms.
That's my guess. And again, there's uncertainty there. And I think it's actually more plausible that that's the case for other plant-derived psychedelics. For example, I think it's a little more probable with like mescaline-containing cacti that you may find differences between strains, or maybe even ayahuasca, where you're actually literally mixing two different plants. But for mushrooms, I think it's unlikely. That being said, the mind is a powerful thing.
Placebo effect is real. So
if you believe that there's in particular, right? If you believe that natural derived is better, and then you're also taking a drug which amplifies the effect of expectations, the natural derived is going to be better. And I'm not trying to realize that. I really mean that.
Yeah. And well, what I'm thinking back to is earlier on in this conversation when you were talking about how the therapeutic psilocybin is administered is there's a preparation phase and then an actual administration phase. And the preparation phase is what I'm thinking of right now. It's like you're preparing to make some massive change in your life, hopefully. And if you believe that, your naturally derived is going to be more effective, then it will be. So what are some other things that you guys typically work on with people before you actually go into administering psilocybin in order to get them prepared for this? Because I think a lot of people are afraid that, cartoons are going to appear, like whatever people think of when they think of being high and tripping on psychedelics is not what it's like.
Yeah. And I would say people are invariably surprised by what ends up happening. But I would say the main three ways we prepare them are, one, getting them comfortable with us, right? Because if they're tripping and they don't feel like they can let go, like they need to feel like they can let go of being concerned about reality, right? Like, am I safe? Is somebody knocking at the door? Did I miss it? Whatever, right? They need to let that go because they're not going to be able to be fully present with what's going on. And so they can only do that if they trust us, right? And that's, I guess, thing one. Thing two is like how to handle what happens. And so we tell people, give your intellect a day off. There'll be time to figure this out later. Try to just experience what's going on, be it sensory, be it emotional, be it, memory, whatever. Trust, let go, be open. So there's almost like a statement of faith there. Trust, let go, be open. Trust us, you're going to be safe. Trust whatever is just happening to you. It could be frightening, but just try to experience it. We even tell people, like, if you feel like you're going to go crazy, let yourself go crazy. If you feel like you're going to die, let yourself die. Again, this is like a statement of trust. Like, we're here to make sure that you're safe. So just go into your experience. Sometimes kind of use the metaphor of like being caught in a whirlpool, and that can induce a sense of panic. You want to swim out of the whirlpool, right? But now you're swimming against a whirlpool. Actually, probably the better thing to do is go inside and you'll come out the other side. And that people experience time and time again in different forms.
Mm-hmm.
And so it's also nice when they have the option of multiple doses over time, because sometimes things will happen, like it'll become apparent that, for example, during one of the sessions, somebody had a need and they didn't want to bother us with that. Like, oh, I didn't want to bug you about that or this, that, or the other. It's like, we're literally there for them to help them with whatever. And so people bring their interpersonal problems in, just like regular therapy. They bring their interpersonal problems in their life into therapy. It's like, why do you feel like you're not worthy enough for us to help you? And then you kind of work on that in the interim. And then the next time, so I don't know. And then I guess the last thing I'll say is that all kinds of things happen. Like, people might have realization, like insightful realizations about their difficulties, and we just kind of talk about those as well.
And where do you conduct the studies, or where are these people when the psilocybin is administered? Are they inside? Are they outdoors? Do you have like a playground, something? And like, oh man, I want like woods and grass.
Yeah, I think I have. So basically, it's conducted in a pleasant, like living room like environment. There's like nice warm lighting. There's like rugs. There's like a very comfortable couch that they're on.
Nice.
And sort of like pictures of oceans and cliffs and stuff. Yeah, it's not outdoors. It's not in nature.
But it's comfortable. It's not
probably, yeah.
It's not an examination room.
Yeah, and I forgot to emphasize that, like, another part of this, which I think often surprises people, and again, this is just kind of like the way that they lurch from one thing to another, trying to figure out in the early stages, like, how should we do this? Is that it seems to be that the best results were gotten with an internal focus. In other words, what people are doing during the experience is they're wearing eye shades, they're listening to music with headphones, they're directing their attention to their own experience. They're not really interacting with us all that much. And so in that sense, it's not guided. We guide them in the sense of like providing a container so that they can kind of like lose themselves and just go into the experience. And sometimes people hit road bumps and they need kind of like much more verbal support or hands-on support. But really the task of the dose itself is like, all right, we've set everything up and now it's time to just sort of experience this internally. And so sometimes that actually just looks like they're lying still for like 5 hours.
Yeah.
You know? And that's not really what you think when you hear the word guide, right?
Yeah. But to them, like, that's a wild 5 hours.
Yeah.
That's awesome. Travis, I think, did we have some questions from some of the listeners?
Yeah, I've got a ton of questions. We definitely covered some of them naturally through the conversation. So I think we probably have time to get into like a few questions from some of the listeners. I think just really good for me, like a really good recap of what I'm hearing is like the importance of kind of how you do it. Cause I think a lot of people just have like random drunken experiences with like mushrooms at some point in their life. And they either have a bad experience or they have really no experience at all. And, like one of the main things I'm hearing here is like the 3-step process and how important that is, like the preparation, you know, what are we going to like work on today? Basically the experience itself, going through it, letting whatever experience you are having have happen. And then the follow-up, whether it's like the, you know, therapy or like journaling, like that sort of thing. I think that's a really, for me personally, like that's a really great takeaway of like the actual like method to be used instead of just kind of like, oh, here's a tab of acid at a music festival, which is, I think, kind of what a lot of people just think that it is, you know? So,
yeah, it's as much a psychotherapy as it is a drug.
Yeah.
Process.
So yeah, a couple questions. One, so we kind of covered this one, but I think this is a really good one to try to like nail down a little bit more. Is one person was curious, like how long do the benefits last? So they've heard about, you know, the benefits of it, like how long do they last? You had at one point had mentioned even 6 months you've seen people, but is it like permanent or is it 6 months? Do we just not know? Is it totally different for everyone?
So in several of the studies, there are benefits that seem to be enduring about as far out as they've looked, like 6 months, 12 months. I think one was even 18 months. And that's for kind of different studies, different indications. Now, that being said, so that's kind of like the nice story that's touted in the media, and it's true, right? Like this does seem to be an enduring positive treatment for many people. However, for just looking at individuals, right? Like, yeah, not everyone, like some, first off, not everyone benefits at all. I mean, some people simply don't get any benefit. And others that do get benefit find that something wears off after some time, or they fall back into old habits, or they simply, you know, they relapse into whatever old problem they had. And so I think that there's the possibility of enduring benefits. And that it's like a very real, tangible possibility, but that doesn't happen for everyone. And for those that get some benefit, but not an enduring one, it may be that like they would benefit from more. And yeah, the other thing is that like, it seems to be that like studies that allow for more doses, those may actually be better.
Larger number of doses.
Yeah, I mean, there's a limit, obviously, at some point, but I think that like that's plausible and likely.
I think, you know, not being afraid to speak from experience a little bit here, I think that at least personally, the duration of time in which I find that utilizing psilocybin for a particular purpose is beneficial highly depends on the amount of work that I'm willing to do after the experience, because I take the experience as a learning opportunity and I'm able to reflect on what I've learned about myself and what things I can implement in order to make the improvements and the changes that I want to see. And as long as I can continue to remember that I've learned this about myself and I'm continuing to work on this, then the results can last. And I think the more really, and I think that's why, at least like therapeutically, combining it with therapy is massively important, because I'll have an eye-opening experience. I'll have a self-actualizing experience and then be able to work through it with my therapist to actually dig even deeper into it and to have like action items to continue to improve on that. So I don't know if, like, you know, kind of like Sandeep is saying, like just taking it might not actually be the solution, but actually understanding what to do with that step 3, that reflection phase, and having action items coming out of it seems to be really helpful. And yeah, maybe you need to redose here and there to remind yourself or to work on something else. But at least for me, that's been kind of the experience.
And I think that sounds accurate to me. For other people too.
Yeah.
That makes me like really curious. Like from the studies, do you guys see, or have you looked into like traits of people that don't get benefits? So like if somebody, it's like
Oh, if they're super type A
I
or
have
something?
like, yeah, I've never been able to successfully be hypnotized. But I know lots of people who are like out, you know, and I think I just am like, I can't be hypnotized. So then I can't be hypnotized. But people who are like, yeah, you know, they can give into it. Is that something you guys look into? Like, is there a trait of somebody like, you know, someone who resists it versus someone who's like, I really want this to work, seeing benefits?
Yeah, this is a tough question. So this is something where maybe it's easier to speak from anecdote than actual research. From the research, modern research, I don't think that we actually have much in the way of good predictors of who ends up benefiting. We often develop these ideas, and I've just noticed that they just are totally unpredictive. We look at like, this person has a history of this, or this person's got this personality structure, or this person's that, or this person's this. And there's just tremendous variability that makes it very difficult to truly know. However, going off some of and you know, we also have to do things in a very structured way. Previously, though, again, from like the 60s and 70s, some of these people that just had like Stan Groff, who had just tons of experience doing this with, I don't know, hundreds of people, seem to feel like people with obsessional tendencies. And that doesn't just mean like, you know, OCD, but also like certain personality traits. I think that sounds plausible to me. And I think my own experience in doing this work,
That it works better for those people?
that it's harder.
Really?
Harder. And it kind of goes both ways, right? Like, oh, maybe this would be good for somebody because they have obsessional tendencies, but it's good for the same reason that it's hard for them to let go, right?
Mm-hmm.
Yeah.
That's interesting.
Yeah.
So yeah, hard to say basically, but if I'm just going off of like other people's experience from the past, that's like one indication.
Mm-hmm.
Interesting. Yeah, cool. Yeah, I would imagine that, you know, the type of person who's like more cynical and, you know, like this doesn't work, I would imagine that they would have less effect from it, or maybe they have to do it more times to like notice like, oh shit, things are different now.
Not necessarily. And it cuts both ways, right? Like people who are very, very gung-ho and enthusiastic, oh, this is going to like fix me, can be disappointed if the things don't happen according to plan, right?
Mm-hmm.
So hard to say.
Yeah. All right. So next, I have another question from somebody, which is interesting around the mental health aspect. Are there risks or adverse effects, or you know, maybe it stops it from working altogether, either microdosing or doing therapeutic doses when you're on like other medications, antidepressants? Sertraline was the example. I'm not sure what that is, but like antidepressants or like, you know, anxiety medications, that sort of thing. Is there like do they interact with each other?
Yeah. So there are risks in general to psychedelics. The question sounds like it's specifically about medication, so I'll restrict myself to that. First off, lithium is the big one that people should know. Probably do not mix lithium with psychedelics. There seems to be a very significant seizure risk. Why that is, we don't know. I think it's totally unknown why that is, but I'm convinced that there is a real risk to mixing lithium and any psychedelic drug. With sertraline, which is an SSRI, like Prozac, Lexapro, that is Zoloft actually. So people will say like, oh, there's a risk of serotonin syndrome.
Mm-hmm.
SSRIs are serotonergic. They affect serotonin, psilocybin serotonergic. And I think that it's something that makes sense to say, but the actual risk of that, it's unclear. There was actually, I think, published today a study where they gave people Lexapro, which is a very similar drug to sertraline, for like 14 days, and they gave them psilocybin, and it was fairly safe. Anecdotally, and we actually have some unpublished data on this, but the net effect of being on chronic SSRIs seems to actually diminish the effect of drugs like psilocybin. Mm-hmm. So nobody can really tell you that it's safe to administer those together. There's a theoretical risk of serotonin syndrome that doesn't seem to be all that likely in practice. Again, there was this brand new study that administered these two together. Chronically, though, it probably does diminish the effects of psilocybin.
Okay. Yeah, that totally makes sense.
And one quick question going off of that. Do you have any recommendations for or things that you guys do rather in your studies after administering psilocybin to help with serotonin? I mean, like 5-HTP, things of that nature?
No.
Okay. That's probably more like an MDMA.
Psilocybin doesn't really deplete serotonin the way something like MDMA does, but even in those MDMA studies, they don't really use supplementation like that.
Interesting. Good to know.
Yeah.
Okay.
What do you do? Obviously, there's some sort of like talking through it therapy. Is it just kind of like therapy and rest, or is there anything else that you do after?
Oh, I would say there's activity. I mean, you kind of want to strike while the iron is hot. Like, it's not just making sense of what happened, and sometimes it's not clear to people what happened. There really is a need to make sense of it. Because it should fit within their lives. It shouldn't just be like this crazy thing that happened, right? It should actually make sense for their lives and be an enduring story that they can carry with them. But ideally, their behaviors also change. Most people who aren't doing well, they're not kind of behaving in a way that is consistent with like them flourishing, right? And so partly it's not just having realizations that they can carry with them. It's also changing their life in some very, very concrete, practical way. And other things that can help are in some way either training skills that are related to whatever they experience. So meditation is a very good example. Yeah, I mean, that's kind of, I actually kind of like a lot of what we do.
Mm-hmm.
Awesome.
I mean, we'll even talk to people about like helping them get a workout routine, or like how to concretely avoid alcohol, or whatever it might be for that person that might be beneficial. So it can get pretty hands-on.
That's cool. Yeah, I think that's an important part of it, the takeaway, the action items.
Yeah.
So one last question. This is from somebody who is in the medical field. They're curious about how you got, like, how to get into this field. Like, is there what's kind of like the future of that, and like how do other people like get involved professionally in this field?
Okay, so if the question is about how to get involved in administering this as a treatment, right, which I'm guessing it is, right now, this is all purely research. So sort of like an academic research job at an academic medical center, which is doing this, which there are increasingly more of those throughout not only the US, but the world. This is kind of stage one. Stage two is if, as seems likely, but it's still an if this gets approved as an FDA approved medication. So look at MDMA, for example. The process is like phase 1, phase 2, phase 3 trials. And you do a couple of those and then it's approved. So MDMA has a successful phase 3 trial already. And so after another one, I mean, this could actually be approved. Again, I'm talking about MDMA in as soon as the end of next year, or maybe 2023. I mean, that's how soon we're talking about. Psilocybin will be a little further down the road. And once that happens, basically, it's a little unclear what the program would look like, but, regular, like physicians, or, I mean, who they have to figure out like who exactly is going to be able to administer this, but there'll be some additional training process, but, it'll be like much more broadly accessible. Right now, it's still fairly restricted to just academic medical centers where you need to be involved in the research.
Gotcha. Cool. Yeah,
That's
I think
really cool.
I think
Yeah.
that's those are probably like the top 3 questions that we haven't touched on at this point. So I think we're good there.
Yeah, I think that was good. This is a topic that I could talk about all day, really, but it's really interesting to hear about the work that you're doing and learn more about exactly how this works, what the future looks like for it. Travis and I think, are both strong believers, and so it's really cool to be able to connect and learn from someone like you. Where can we learn more about this on our own after the podcast? What resources do you have that you think would be useful?
Well, I mean, Hopkins has a newsletter, for one.
Okay, let's sign up for that.
There are lots of good books out there, depending on like how nitty gritty you want to go. I think Michael Pollan's book is great. I don't know if you've come across that, How to Change Your Mind.
That's supposed to be really good. Yeah.
Yeah. I thought that book was really good, even as somebody who kind of already knows a lot about the topic. And then, I don't know, then it's also like, if you're not just interested in like the modern research and the therapy and all that, there's also a very fascinating history. Like Mike J has this book called Mescaline, which is like, this is actually the first psychedelic that was ever discovered. People forget that like there was psychedelic research going on in the late 1800s and early 1900s with mescaline. There were German chemists who were, but that's just a beautiful book. And there's probably more I can think of. Aldous Huxley's Doors of Perception, fantastic book. And then, a lot of the researchers now who are doing this work are on Twitter, and they're at like Imperial College London, they're at UCSF, they're at Hopkins, and they're often they're at Yale, they're at NYU. There's like so many now. And those centers, just kind of going to their web pages, they have a lot of useful information as well. Kind of what I can think of off the top of my head, I think.
No, that's beautiful. And especially the books and Twitter is either a wealth of resource or a wealth of garbage. But it sounds like if we're following the people that you've recommended or the universities and schools that you've recommended, I think we'll be in good hands. Before we let you go, how do people find you? How do we keep more up to date on what you're doing? Besides the newsletter, we all got to get on the newsletter.
Yeah, I mean, I am on Twitter. I guess that's my only real social media presence. It's SDP Nayak, Nayak. And yeah, that's probably the best way to reach me at a distance.
Okay, cool. Well, yeah, we'll connect with you there and check out the Hopkins newsletter. And I really got to thank you for coming on here to talk about this, man. It's a topic that we've talked about quite a lot on this podcast because we realize, exactly how important, how useful, how helpful it can be. Every now and then, enduring just a little bit of struggle, and some of our psychedelic experiences can make us stronger on the other side. So for real, man, I really do thank you, and hopefully this isn't the last time that we are in touch.
Yeah, it was absolutely my pleasure.
Awesome. Well, thank you to everybody who's tuned in. This has been another episode of the Struggle to Strength podcast. I hope you guys all learned a lot, and we will see y'all next week.